Well, hello everyone. This is Dr. Amigues, your friendly rheumatologist and host of the Unabridged MD podcast. Today, we are going to talk about something that I'm sure you're very excited to talk after Thanksgiving, which is metabolic health, overweight, and how to help with this and how it's related with arthritis. And we are joined by a specialist, Dr. Lindsay Ogle. Thank you so much for being on the podcast, Dr. Ogle. And we are going to talk about your zone of genius, which is really metabolic syndrome and obesity and how it's related to inflammation and inflammatory arthritis. I think what would be really wonderful is if you could talk to us to begin with of how you got into that space.
Yeah, absolutely. Well, thank you so much for having me here and talking to your audience about this important topic. So I am originally trained in family medicine and primary care, and I chose that because I really wanted to focus on preventative health and helping people achieve and maintain their health and well-being and live longer and fuller lives. And so I always wanted to get to the cause of these chronic conditions that we see so commonly in medicine. And along that way, through my training, I was introduced to obesity medicine because excess weight can be related to so many of our most common chronic conditions. Did some additional training in that area and got my board certification in both family medicine and obesity medicine. And one of the interesting things we're learning so much about obesity, like in the field of obesity medicine, is just how the weight is, or the excess weight is metabolically active and how it affects our health and our whole, every system in our body. And I know we'll talk about inflammation along with that. But I also like to bring awareness to a condition, metabolic syndrome, that many people aren't even aware of.
Yeah, I really would love that. And I think the auditors will love this. There is a lot of talks about adipose tissue, about obesity. And it's true that we've had other guests that have talked to us about the inflammation and how it's related to obesity and adipose tissue. We've never had a talk about metabolic syndrome. So maybe if you could define what is metabolic syndrome for an audience that may have never heard of that word before.
Yeah, absolutely. So to metabolic syndrome, you need 3 out of 5 conditions. So one is elevated blood sugar, another one is elevated blood pressure. You need a elevated triglyceride level. You need low HDL cholesterol, and then the 5th is increased abdominal circumference. So if you have 3 out of the 5 of those kind of symptoms or signs, then you meet diagnostic criteria as having metabolic syndrome.
So I think that what's really interesting is to realize that you have to look for that, because if you think about it, I don't think in a family, like in a practice, you check the circumference of your abdomen. I don't think anyone has ever done that. At least I've never had that done. I don't think we look at lipid profile all of the time. And I don't think that people know that you don't need necessarily to have diabetes, but then just elevated glucose is enough to make this diagnosis if you have 2 other criteria. So you said hypertension, elevated blood pressure, elevated glucose, elevated circumference of your abdomen, and then I guess obesity or overweight. And then the lipid, there are 2 of those components, low HDL or high triglyceride. Is that correct?
Correct. Yeah. Yes. And I definitely want to highlight what you said about looking for it, because as I've been practicing primary care, we're busy doing many other things in our practice and helping our patients in many ways. And looking for metabolic syndrome is not always top of mind. So often we can see these abnormalities and may be addressing each one individually, But really, if we took a step back and were able to notice the full picture, then we could see that somebody does have metabolic syndrome. And then if we are able to make that diagnosis and have that awareness, then we can address that, which would then help all of those symptoms.
Mm-hmm. So I think that leads us to the second question is like, why is it so important to make a diagnosis of metabolic syndrome?
Yeah. Great question. So again, I think it gets back to just making sure that we are treating the underlying condition instead of treating the end symptoms. So if we are able to then focus on, and some of the things that can, help with metabolic syndrome would be weight management and lifestyle optimization. So some of the things we hear all the time and you talk a lot about on your podcast with healthy living. So making sure we're being physically active, eating a nutritious diet, focusing on whole foods rather than processed, specifically avoiding added sugars and high fructose corn syrup can really contribute to metabolic syndrome. Managing our stress, sleeping well, all of those things that we hear time and time again that are good for us. We hear them very often for a reason because they are good for us, and we just need a reminder for that. So looking at implement those lifestyle changes can really help with the whole picture.
Okay. Oh, I think that's really wonderful. And I think really like when I'm listening to you, what I'm hearing is how much we're probably missing about metabolic syndrome. And I'm wondering, can you just share something? So one of the things that has been an issue for my patients, for example, some of my patients, of course, is that, so we know that there are some really good treatment to be obese, to take care of the obesity. But very often, like unless you have diabetes, you have to have obesity plus some comorbidities, which, it's actually really annoying because you know that this can prevent, and you're like, why do we need to have complications? So I have a question for you. All the studies are clearly showing that there's an improvement of metabolic syndrome with those drugs, GLP-1 agonists, semaglutide, tirzepatide, etc. Do insurance have to, normally, should they approve if you have metabolic syndrome in addition to obesity? I just want to know if they actually look at that.
Yeah, so I am not aware of the GLP-1 agonists being covered for metabolic syndrome. It definitely could help having that listed as a diagnosis, and I have used that to help, supplement to get some of them covered. What we have seen recently are more and more studies, like you said, proving that these medications are helpful in so many different areas. Fatty liver disease, which is not a part of metabolic syndrome, but that is something that we are seeing evidence that these medications are helping with. And so I anticipate that in the very near future, we'll have those studies, and hopefully we will be able to have approval for those medications to help with metabolic syndrome, because absolutely for my patients who we have identified this with, if they are able to be started on one of these medications, I do see that their metabolic syndrome improves.
Yeah. Okay. And so in the world where there was no insurance issues, would you just get patients who are with an obesity, so BMI more than 30, or even BMI more than 28 with comorbidities? And would you just say, okay, you have a BMI of more than 28, plus you actually have a metabolic syndrome? Would you say that this is probably the patients that will also, those patients will actually also benefit from those drugs?
Yeah. I think that they would definitely benefit from these medications along with the lifestyle changes. And so the way that I view GLP-1 agonists, I mean, they definitely help with, regulating the hormones in the body to augment the weight loss. and improving insulin resistance and all of those things. But they are kind of, I had somebody explain it recently, and I really like this analogy, is that they're almost like training wheels. So they can be really helpful to help us implement those lifestyle changes that can be so hard to implement without the help of the medications.
Yeah.
So yeah.
It's funny because I'm actually really into complementary medicine, and I love even energy healing and all of those. But I have to say, there is like a study that just came out. I'm so sorry, I don't remember where it came out, but it was a good journal. And what they found is that they looked at, I think it was GLP-1 agonist, I think it was semaglutide, that they used for osteoarthritis of the knees for patients. And what they found is that patients did lose weight, which it was expected, right? But they also found that they had much less pain and they had more function of their knees. And so to me, I'm like, hold on. We've been trying to find ways to help our patients for years. Here are those drugs. And I get the fact that we're saying that our training wheels, but I almost want to say, no, I think that in this case, they are not training wheels. I don't think that patients are not trying. I think they're trying so hard to get to a proper weight and to be healthy. And there's so much sugar in all of our food that makes us want to eat more. And you have to have an incredible, I mean, like if it was really just mindset, those drugs would not be so efficient, right? Like I just don't believe it. And so I find almost offended to think that those are training wheels when I actually think it's the opposite. Like I think that we put this, and this has changed the life of so many patients. And then once they are on this, it's kind of like the wagon, like, when you have a train that's like pushed and like at the beginning, it needs a lot of help. And then after that, you don't need any help. That is more of the image that I'm seeing than the training wheel, because I find it almost offensive in a way to think that our patients are like that this is the only thing that it does when our patients have been trying so hard to lose weight and nothing works. You put them on GLP-1, they lose weight. And because they lose weight, they're able to exercise. Because they exercise, they are able to maybe have a better relationship with food. They learn the relationship with food thanks to those drugs. Like, sorry, I'm getting very French and very live. But you know what I mean when I say that, I'm just like, wow, like for me, those drugs are life-saving. They're changing healthcare. I was talking to a nephrologist who told me that they expect to have less patients on hemodialysis, that we will need less patients transplanted of kidneys because of those drugs. The same is said for cardiovascular health and heart. And so I'm like, training wheels? No. Sorry. I'm sorry.
So, yeah. Another analogy I think about it too is like it's an advancement that we have, and we used to only be able to walk or ride our horses for transportation, and now we have cars and trains and planes, and
I like that.
Yes, and so we wouldn't, not use the new forms of transportation that we have. We use what's available, and over time those improve, and we're just at a point in medicine where we have the really great tools to use. So that's another analogy I really like as well.
I love that analogy. I'm so sorry I got like a little bit heated on that, but it's just, okay, everyone out here that's listening to this podcast, if you have been struggling with adipose tissue, I'm not even saying weight, adipose tissue, it is not your fault. It is not your fault. Number one, we don't know how to eat. I really, and especially in America, guys, like go to France or go to Italy, although we are becoming very fast food and all this, but like there is a culture about eating in the US that's very different than the culture about eating in France, like 100%. I find there's a lot more guilt in the US than there is in France. Like no one will ever feel guilty unless you're a vegetarian, which is totally possible, but you won't feel guilty about eating foie gras, which is, this fat liver, which is, we don't want to know how it's being made because that's pretty awful. But like there's no guilt. Like you will never see someone that's eating foie gras in France feeling guilty about that. Never. Whereas here I find some patients will tell me, oh, I ate this and I ate that and I feel so guilty about this. And we're like, well, if you're eating something, just enjoy it. And then and the metabolic syndrome, what we're talking about right now, I don't think it's a choice. And I think what's a choice is to take a medication that can potentially help you. It's to change your lifestyle. And that's something that you work with, right, with your patients about lifestyle. And I think that hand in hand, without any guilt, that's when we get our patients to get to a proper and healthy adipose content of their body, or weight, BMI. So sorry, since I've gotten really excited about this. Tell us a little bit, so we are after Thanksgiving. We're recording this before Thanksgiving, but we're going to be after Thanksgiving when we put this episode out. What would you tell patients if they come to you and they are feeling guilty because they ate the turkey, which by itself is not bad, but I guess the gravy and is there what you guys, there's this jam, sugar, and then all the pies. All right. What do you tell
pumpkin pie.
Yeah, right. What do you tell patients? First of all, it's Thanksgiving. Why should we feel guilty? It's one time. It's fine. What do you tell patients to get back on the wagon of health? What do you tell them? It's okay. What are some things that they can do today when they are listening to this episode?
Yeah, absolutely. And I totally agree with you. I think step number one is to stop beating yourself up. That does no favors for anybody. It really just can continue a cycle of self-loathing that is not going to put you into a healthy mindset and routine. And it's easier said than done, and that's why some people really do need to work with a coach or a therapist to help with some of that mindset shift. But for my patients, I really try to instill some positivity in there, because no matter what your size is, people tend to overeat from time to time. It happens, and that's okay. You're not any less worthy as a human, and it does not mean that everything that you've done in the year prior to Thanksgiving, that has not all gone to waste. You are still making progress, even if you did overeat for the holidays. And so just taking a moment, take a deep breath, and I don't even want to say forgive yourself, because there's nothing to forgive. You can just kind of reset and think about your goals moving forward on making a decision for what you want to eat, and provide nutrition for your body for that day that you're starting.
I love it. Well, as we come to a close to our episode, and thank you so much, Dr. Ogle, and I hope I didn't scare you by being so lively and so excited about just how we see overweight and how we see obesity. And I know you're in that, you're in this, so you get it, right? So yeah, there's so much guilty. I have had patients where they're providers, and I'm using that term because it wasn't a doctor. Sometimes it's doctors, sometimes it's not doctors, that are telling my patients just lose weight and everything would be fixed. And they're like, well, they have inflammatory arthritis. Yes, it will help, but that's not enough. I'd like to have you share with us maybe a history of hope, since our podcast is named, unabridgedly Hope Driven by Science. Do you have a history of hope that you can share with people here today?
Yeah, absolutely. So it's I'm kind of coming up with like a group of patients, like all coming together. And I've had patients that have come to me and they, like kind of what you said, that their experience with doctors in the past is that they haven't been spoken to kindly, and they haven't been listened to, and they haven't been believed that they are trying and, eating healthy. They are just kind of brushed off. And if that has been your experience, I just recommend continuing to try to find a doctor that is going to listen to you, because we're out there, and I know it can seem like it's impossible to find us, but keep looking and get some references, because you can find somebody who is really going to trust and believe you and partner with you in your journey towards health.
Wonderful. And so where can we find you?
Yeah, so I'm on Instagram, and I just started TikTok. I also have a YouTube channel, all under my name, Dr. Lindsay Ogle. And I started my own telehealth clinic called Missouri Metabolic Health, where I serve patients throughout the state of Missouri. I can't hear you anymore, sorry.
Sorry. So I was just saying, thank you so much, Dr. Ogle, for being on the podcast, and thank you for sharing your zone of genius with all of us. If you are in Missouri and that you're looking for obesity doctor, please check out Dr. Ogle. If you're just willing to learn about overweight, obesity, lifestyle changes, as well as metabolic syndrome, follow Dr. Ogle on our Instagram account and our YouTube video. And I'm sure we'll have you again on the podcast. It's been such a pleasure. Thank you so, so much. And to everyone listening, if you feel like this episode has helped you, or if you think that someone may benefit from this episode, please share it with 1 or 2 people today, or even more if you have. And until then, we will see you next week. Have a wonderful, wonderful week. Take care, everyone. Bye-bye.